The legislature offered hospitals a lifeline this week, but pulled in another, and the Trump administration has another big Medicaid cut in mind. Welcome to the May 22nd edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
This week, the Minnesota legislature wrapped up its business on Monday and left the Capitol, likely for the last time before the fall elections. They passed a rescue plan for HCMC and offered some aid to other hospitals. The Star Tribune's Jeremy Olson wrote about the deal this week.
Well, there was definitely a priority on protecting HCMC given its financial concerns, a $205 million immediate rescue package, and a $500 million stabilization fund to save the hospital in the future if it continues to have problems. Beyond that, there was discussions of about $100 million or more to also support small hospitals that were struggling. That number got whittled down to about $30 million. Hospitals can apparently use that to tap when they have uncompensated care costs. And then at the small level, about $50,000 per critical access hospital, just to recognize the struggles of those smallest hospitals, even with a very small amount of funding.
The deal also included some new reimbursements for medical assistance by the state.
Critical access hospitals will see about $3 million more in the next year, about $15 million more in the next biennium, but that money continues on. So no matter what happens at the federal level in terms of clawbacks on Medicaid, reduced eligibility and things, that's just more that will stay in the pockets of critical access hospitals.
On Wednesday, Governor Tim Walz and his senior healthcare advisor, former State Health Commissioner Jan Malcolm, were at HCMC to talk about the legislation.
The takeaway message to Minnesotans is whether you're in Wilmer, Sleepy Eye, Duluth, Two Harbors, Hennepin County Medical Center matters to the quality of care for your hospital, and it matters all the way across the state.
Malcolm, for her part, said she thought lawmakers would return to address hospitals again soon.
I've been out talking to all of our health system leaders, and I am really struck by the fact that they all are very clear-eyed about the fundamental nature of the challenge. So we are going to have to collectively come back to the legislature in future years with proposals to redesign some programs, to redistribute how some of the funding exists now, so that we do kind of stabilize the most critical services first.
But help for hospitals at the Capitol this session did not include a key ask: enforcement provisions for a law that banned drug makers from picking what Minnesota pharmacies would be eligible for the federal 340B drug pricing program. Drug makers limit the availability for that discount despite a 2024 state law. The discount is a source of more than $1.3 billion in hospital funding annually, according to a state report earlier this year. Hospitals estimated enforcement of existing state law would bring in another $150 million a year, which drug makers fought with a months-long lobbying campaign, according to the Minnesota Hospital Association's Michelle Benson.
It ended with a bipartisan vote in the Senate, and we ran into some pretty strong headwinds in the House. We know we had the votes to pass it if a vote had been brought to the floor, but Pharma did a lot of advertising. They spend millions of dollars.
The state 340B law expires next summer, which means the next legislature will likely revisit the issue.
Also this week, Allina Health and Sutter Health announced Thursday that they have approved a definitive agreement, taking the next step toward their shared goal of creating an integrated nonprofit health system. The organizations aim to expand local access to high-quality, affordable care while improving the experiences of patients and caregivers. Warner Thomas, president and CEO of Sutter Health, said, quote, "We will lead the way to accelerate solutions, recruit more physicians, and expand locations to improve access and redesign how care is delivered for our patients and communities." Sutter has said it intends to invest more than $2 billion in Minnesota and western Wisconsin. And CMS Director Mehmet Oz and HHS Secretary Robert Kennedy Jr. were in Minneapolis yesterday to announce indictments against 15 more people, alleging $90 million in Medicaid fraud linked to a housing program, autism services, and services for disabled Minnesotans, as well as child care subsidies.
The indictments and arrests came weeks after a series of federal raids at social service providers around the Twin Cities, as well as Thursday's sentencing in the Feeding Our Future scandal. Alleged mastermind of that scheme, Amy Bach, was sentenced to 41 years in prison by a federal judge. And as expected, CMS this week released a proposed rule that would sharply lower the limit on some Medicaid reimbursements, also known as state-directed payments, or SDPs. Ellen Florek has more.
These payments could be a major source of federal Medicaid funding for Minnesota hospitals. But the new rule carries out part of last year's One Big Beautiful Bill Act and follows vocal criticism by the conservative Paragon Health Institute, which called the directed payment programs money laundering last year. The proposed rule would lower the SDP payment substantially in states that previously expanded Medicaid as part of the Affordable Care Act. More than 40 other states have optional directed payment programs, and Minnesota finally established one in state law last year. But that came only one day before the big, beautiful bill was signed. The state program was intended to bring nearly $1 billion in additional Medicaid funding to the state, but still hasn't won federal approval, nearly a year after it was submitted. The proposed rule doesn't appear to block approval of Minnesota's program, but it isn't clear what impact it will ultimately have. That said, the Trump administration says its proposed changes will cut federal Medicaid expenditures by $770 billion by 2035.
And that's it this week from Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
Thanks for listening.